Nursing Assistant Study Series, Group 1. Professional Communication in Healthcare. Welcome to the Easy Life Studio Nursing Assistant Study Series. In this first lesson, we will begin with the role of the nursing assistant, professional behavior, and effective communication in a healthcare setting. These are important concepts for CNA students because nursing assistants communicate with residents, families, nurses, and other members of the healthcare team throughout every shift. If you are preparing for your CNA class or competency exam, please subscribe to Easy Life Studio and continue studying with us throughout this nursing assistant study series. Let's begin. The role of the nursing assistant. Nursing assistants, also called nursing aides, are important members of the healthcare team. Nursing assistants work under the supervision of licensed practical nurses, licensed vocational nurses, and registered nurses. They provide basic care and assist residents with activities of daily living. Common nursing assistant responsibilities include bathing residents, helping residents use the toilet, assisting with dressing, turning and repositioning residents, transferring residents between beds and wheelchairs, serving meals, helping residents eat, measuring vital signs, and listening to residents' health concerns. Observation is also an important responsibility. When a nursing assistant notices a health concern or a change in a resident's condition, that information should be reported to the nurse. The actions and skills a nursing assistant is permitted to perform are determined by the nursing assistant's scope of practice. Scope of practice may be affected by state law, training, facility policies, and the nursing assistant's job description. A nursing assistant should understand their responsibilities and always work within their scope of practice. Professional qualities. Nursing assistants care for people who may be sick, injured, physically weak, cognitively impaired, or dependent on others for assistance. Important professional qualities include good communication skills, empathy, compassion, physical stamina, and professionalism. Communication skills are especially important because nursing assistants must listen carefully to residents and communicate important observations to nurses and other healthcare professionals. Empathy and compassion help nursing assistants provide respectful care to residents who may be experiencing illness, disability, pain, fear, or loss of independence. Professionalism means providing care in an ethical, respectful, competent, knowledgeable, and caring manner. A professional nursing assistant protects the dignity and well-being of residents. Professional behavior includes communicating respectfully with residents, family members, co-workers, nurses, and other members of the healthcare team. A nursing assistant should introduce themselves before providing care. Professionalism also includes appropriate personal hygiene and appearance, being dependable, arriving at work on time, completing assigned duties accurately, understanding your scope of practice, and continuing to learn. Beginning and ending resident care. There are important steps to remember when beginning and ending personal care. Before beginning care, provide appropriate privacy. Introduce yourself to the resident. Explain what you are going to do. Perform appropriate hand hygiene. During care, maintain the resident's privacy, dignity, comfort, and safety. When care is finished, ask whether the resident needs anything else. Make sure appropriate safety measures are in place before leaving. Perform hand hygiene as appropriate after providing care. Correct hand hygiene is one of the simplest and most effective methods of preventing the spread of infection. Professional appearance. Good personal hygiene and grooming are part of professionalism and infection prevention. Wear clean clothing or scrubs according to facility policy. Hair should be clean and appropriately maintained. Long hair may need to be pulled back for safety and infection control. Nails should be clean and trimmed. Wear comfortable, closed-toe shoes with non-skid soles. Follow your facility's policies concerning jewelry, piercings, tattoos, and other appearance requirements. Strong perfumes and other strong fragrances should be avoided because they may cause headaches, nausea, breathing difficulties, or allergic reactions in some residents. Wear your identification badge according to facility policy. Nursing assistants should also use healthy strategies to manage stress and notify their supervisor when they are ill according to facility procedures. What is communication? Communication is the process of exchanging information through words, signs, symbols, or behaviors. Effective communication helps create trusting relationships and improves resident care. Communication is also essential to holistic care. Holistic care addresses a person's physical, emotional, social, and spiritual needs. The basic communication process includes a sender, a message, and a receiver. The sender communicates information. The message is the information being communicated. The receiver receives and interprets the information. For communication to be effective, the receiver must correctly understand the message. Because misunderstandings can occur, nursing assistants should verify important information when necessary. Verbal communication. Verbal communication involves spoken words. Language, culture, education, and previous experiences can influence how people understand words and phrases. An expression that seems obvious to one person may have a different meaning to another person. Nursing assistants should therefore communicate clearly and use language the resident can understand. Avoid unnecessary medical jargon or complicated terminology when communicating with residents. Explain information using simple, understandable language. Nonverbal communication. Communication involves more than spoken words. Nonverbal communication includes body language, facial expressions, body movements, posture, tone of voice, and the pace of a conversation. Nonverbal behavior can significantly affect how a message is interpreted. For example, imagine telling a resident, "I'm happy to help you," while appearing irritated, avoiding eye contact, or speaking impatiently. Although the words sound positive, the resident may interpret the nursing assistant's nonverbal behavior as negative. Nursing assistants should therefore pay attention to both their words and their nonverbal behavior. They should also observe the resident's nonverbal communication. A resident may say everything is fine while their facial expression, posture, or behavior suggests pain, fear, discomfort, or sadness. These observations can provide important information about the resident. Easy Life Studio Study Reminder. You are about halfway through Group 1. If this CNA study lesson is helping you understand your nursing assistant material, please subscribe to Easy Life Studio so you can continue learning with us through the complete series. Now let's continue. Adapting communication. Healthcare professionals should assess a resident's preferred method of communication and adapt communication according to the resident's individual needs. For example, a cognitively intact resident might be asked, "What would you like for lunch?" However, a resident with cognitive impairment may become overwhelmed by an open-ended question. Instead, the nursing assistant could ask, "Would you like soup or a sandwich?" This allows the resident to participate in the decision while reducing confusion. Communication should be adapted to the resident's cognitive ability, developmental level, sensory needs, and other individual characteristics. Communication styles. 3 communication styles are passive, aggressive, and assertive communication. A passive communicator tends to put the rights of others before their own. Passive communicators may sound apologetic or hesitant, and may fail to speak up when they believe something is wrong. An aggressive communicator may advocate for their own rights while disregarding the rights and feelings of others. An assertive communicator respects the rights of others while appropriately expressing their own thoughts, needs, and rights. Assertive communication is generally the most professional approach. An assertive person communicates directly without being insulting or offensive. One useful technique is using I statements. Examples include, "I feel," "I understand," and "help me understand." Using I statements can reduce the likelihood that the listener will feel personally attacked. Assertive communication can help nursing assistants address problems professionally with residents, co-workers, nurses, and other members of the healthcare team. Communication barriers. Many factors can interfere with effective communication. One common barrier is jargon. Avoid complicated medical terminology or unfamiliar words when communicating with residents. Use language the resident can understand. Another barrier is lack of attention. When caring for several residents, it can be easy to focus only on completing tasks. However, care should remain person-centered. When communicating with a resident, give appropriate attention to the person. Noise and distractions can also interfere with communication. Healthcare environments may contain televisions, alarms, conversations, and overhead announcements. When possible, reduce unnecessary noise. Lighting can also affect communication. Make sure the lighting is appropriate for the resident's needs. Hearing and speech difficulties can create communication barriers. Residents may use hearing aids, eyeglasses, whiteboards, picture books, microphones, or other communication devices. Make sure appropriate assistive devices are available according to the resident's needs and care plan. Language differences are another possible barrier. When English is not the resident's preferred language, an appropriate medical interpreter may be necessary. Cultural differences can influence communication. Personal space, eye contact, touch, emotional expression, and responses to pain can vary among individuals and cultures. Nursing assistants should communicate respectfully without assuming that every resident shares the same beliefs or preferences. Psychological conditions can also affect communication. Fear, anxiety, stress, distraction, and feeling overwhelmed may influence how information is communicated and understood. Physical conditions may also interfere with communication. For example, a resident experiencing significant pain may have difficulty concentrating on what is being said. Certain medications may also influence comprehension and responses. Residents should feel heard. Information should be communicated in a non-judgmental manner even when a resident's beliefs or viewpoints differ from those of the nursing assistant. The healthcare team. The resident is at the center of the healthcare team. Nursing assistants frequently communicate with other nursing assistants, licensed practical nurses, registered nurses, and other healthcare professionals. Effective teamwork contributes to quality resident care. Poor communication can interfere with the team's ability to provide safe and holistic care. Professional relationships begin with respect. Nursing assistants should know their responsibilities, perform assigned duties, document and report completed care, and behave consistently and dependably. Organization and time management are also important. At the beginning of the shift, nursing assistants should review the plans of care for their assigned residents. Important information may include the resident's activity level, transfer status, assistance required with activities of daily living, diet and fluid orders, and elimination needs. Transfer status describes the assistance a resident requires when moving from one location to another, such as moving from a bed to a chair. Some residents may require more than one caregiver for a transfer. If the care plan requires a two-person assist, the nursing assistant should follow that instruction. Activities of daily living, also called ADLS, are basic everyday activities. Examples include hygiene, elimination, dressing, eating, and ambulation or movement. Diet and fluid orders identify what a resident is permitted to eat and drink. Elimination needs describe assistance required with urination and bowel movements. The nursing assistant should follow the resident's current care plan. Reporting care. As resident care is completed, it should be documented in a timely manner and appropriately reported to nursing staff. Reports should include relevant observations and changes noted in the resident. Nursing assistants spend significant amounts of time directly interacting with residents. Because of this, they may notice changes before other members of the healthcare team. Reporting these observations is an important nursing assistant responsibility. Do not diagnose the resident. Observe, document, and report according to your role and facility procedures. Group 1 Review. Remember these key points. Nursing assistants work under the supervision of licensed nurses. They provide basic care and assist residents with activities of daily living. Always work within your scope of practice. Protect the resident's privacy, dignity, comfort, and safety. Use appropriate hand hygiene. Communicate clearly and respectfully. Pay attention to verbal and nonverbal communication. Adapt communication to the resident's individual needs. Assertive communication respects both your rights and the rights of others. Recognize communication barriers and reduce them when possible. The resident is at the center of the healthcare team. Review and follow the resident's care plan. Know the resident's transfer status, ADL needs, diet and fluid orders, and elimination needs. Observe residents carefully. Document completed care and report important changes to the nurse. You have completed Group 1 of the Easy Life Studio Nursing Assistant Study Series. Please subscribe to Easy Life Studio so you don't miss Group 2, where we will continue with therapeutic communication, active listening, professional touch, and other important communication techniques for nursing assistants. Thank you for studying with Easy Life Studio.